Alveolar bone grafts are used for a variety of patients, such as those with bone resorption due to periodontal disease or implant cases that require regeneration of bone for placement. Other grafting needs are seen in cleft palate patients. It is advised that an alveolar bone graft is performed between ages 8 and 10 in cleft palate cases. A graft during the mixed dentition phase is best so that the canines can migrate and erupt through cancellous bone. The goals of this are to establish a solid foundation for the adult dentition, stabilize the maxilla into a single arch, and close soft tissue defects. The first type of graft we will discuss is an allograft. This material is derived from humans. Allograft bone is taken from cadavers or deceased individuals and is typically sourced from a bone bank. There are 3 types of bone allograft available: fresh or fresh frozen bone, freeze-dried bone, and demineralized freeze-dried bone. The use of allografts for bone repair requires sterilization and deactivation of proteins normally found in healthy bone. The extracellular matrix of bone tissue contains a cocktail of bone growth factors and proteins necessary for osteoinduction and successful bone healing. A demineralizing agent, such as hydrochloric acid, is often used to degrade unwanted proteins and factors while preserving osteoinductive agents, such as bone morphogenic protein, that causes new bone formation. Autogenous bone grafting involves utilizing bone obtained from the same patient receiving the graft. Bone can be harvested from non-essential cancellous bones, such as the iliac crest, mandibular symphysis, and anterior mandibular ramus, or zygomatic crest. When a block graft is performed, autogenous bone is the most preferred and is considered the gold standard because there's less risk of graft rejection due to it originating from the patient's own body. It is osteoinductive, osteogenic, and osteoconductive. The disadvantage of autogenous grafts is having an additional surgical site, creating another potential location for post-op pain or complications. Xenografts are bone grafts from a species other than human, such as bovine, and are used as a calcified matrix. Alloplastic grafts are a synthetic bone graft made from hydroxyapatite, the calcium phosphate mineral that makes up a large amount of enamel, dentin, and bone. It is used due to its osteoconduction, hardness, and acceptability by bone. The use of tricalcium phosphate aids in its ability to be resorbed.
Epithelial tissues have the highest number of cells compared to other tissues in the body. This tissue covers the body, lines body cavities, and forms glands. It has a limited ECM, however. Connective tissues contain a higher amount of ECM. Connective tissues are the most abundant type of tissue in the body. The ECM consists of cells, ground substance, and protein fibers. Dentin grafts are used in bone grafting due to dentin's similarities with the bone. A dentin graft is extracted teeth that have been ground up and processed into particulate dentin that is bacteria-free. This dentin particulate is then used in the affected area, such as in an empty socket after tooth extraction. Dentin grafts are safer to use than bone grafts, and they share many of the same components from the ECM as well as their structural components. Bone grafts can be risky, and the chances of success are lower than dentin grafts. Dentin grafts have been shown to have a higher success rates and reduced instances of inflammation and complications. So tissue scaffolds and mesenchymal stem cells. Tissue scaffolds can be a variety of materials, but they're engineered materials that mimic the ECM of the native tissue. They are designed to be absorbed and new tissue to take over its place. MSCs, or mesenchymal stem cells, are seeded onto scaffolds along with their biochemical factors for tissue development. Mesenchymal stem cells are multipotent stromal cells able to differentiate into different cells like osteoblasts, chondrocytes, myocytes, and adipocytes. Adult stem cells, they can be found in bone marrow, umbilical cords, amniotic fluid, the tooth bud of the mandibular third molars, and many more places that mesenchymal stem cells could be found in the body.